We are live. It is Sunday night. Hey, Stephanie, you are number one, girl. You are here. Let me just check my audio settings. Okay, great. We had some issues a couple weeks ago coming in. So I am so glad you're here. I'm gonna let you guys come in. Tonight's episode is a really important episode. We're going to talk about women's health, but also I need you men to listen because you have women in your lives who are dealing with the things we're going to talk about tonight. And the true epidemic that we have in our country is women's health. Well, the health of Americans is really just in the gutter. And then women's health. And there are no I shouldn't say no. There are very few options for women to find answers for what they're looking for. So you're going to see in tonight's presentation what is actually going on. And we're going to talk about women's health from a young age, from preconception age. So women in their 20s all the way up to menopausal women, and what that looks like and the struggles that women go through, as well as the common concerns, how they are all tied together, and then what can we be doing about it? How can we get more women answers to these really important topics so that we can make sure that we're living our best lives full of vitality and energy, and making sure that we've just got an amazing future ahead of us, like post-menopause. But a lot of this starts from a younger age, and it's really common. And I'm going to show you a presentation that I'm actually presenting. Well, I'm presenting it for the first time officially to a group of women chiropractors on Saturday. So I thought I'd bring it to you guys first, because this would be a great place for me to present this. If you have questions, comments, concerns, anything that might seem confusing, or just anything else in this world of women's health that you'd like to see, because I'm going to present this to women chiropractors on Saturday as a way to help women chiropractors and other healthcare professionals to start implementing the things that I'm talking about into their practices, to help more women into their practices, really starting to cast a wider net and start to expand who we help and how we help them. So I'm really excited about this, and I hope you are too. So if you are here, please make sure you hit that thumbs up button. If you are on the replay, hit the thumbs up button anyway, and drop in the comments if you're here live or if you're on the replay, so I know where you're coming from. And also, just feel free to drop your questions. Let me know, what do you struggle with as a woman? What kinds of answers have you been able to find? Or have you not been able to find answers to things that you might have going on? Many women struggle for years before they end up finding the path that works for them. And we're going to see that as we start to go through the slides to see exactly, what's going on. Why don't women get the help that they need? And like I said, from a male perspective, this is really key, because it's hard for men to understand women's hormones. Would you agree? I mean, men, you guys are like, we could never figure out women because of a multitude of things. But then we've got hormones in the way, and man, those hormones, boy, when they start rolling. And of course, as we go through the different phases in our lives, our hormones they're up and they're down, and nobody knows we don't know what to do with them, let alone the men in our lives know what to do with them. So, hey, hi, how are you? Nice to see you in here. Thanks for being here. So this is an opportunity for men to have a little bit more understanding and be able to support their female partners, their loved ones, their mothers, their sisters, their daughters, especially if you have kids and grandkids. This is a huge, huge topic. And I'm going to talk to you a little bit about a couple of patients that I have, young patients that I have that are concerned about their ability to have children, boys and girls, young men and women. their ability to have children. What does it look like? Can they ever get their reproductive health on track? You know, they're struggling now in their teens and their 20s. Not that teenagers want to be getting pregnant, but that's when we really need to be paying attention to this stuff so that we can help our young girls move through it. And that's when I always say too, boys aren't off the hook. Boys are not off the hook. So you're going to see this come through. So it's easy to blame a lot of reproductive things on women because men have one job and then that's it. And then women carry life. And, you know, that's with this. So then we think that, oh, it's the woman's responsibility genetically and from a health perspective. But guys, that sperm has to be, it's got to be super, super strong, and it's got to be super healthy. So, we'll see exactly what we're talking about here in a minute. So, all right. So with that being said, let's go ahead and pull up the presentation. And again, if you're dropping in, go ahead and hit the thumbs up button, hit the subscribe, share this with a friend who might be struggling with some hormonal issues, some women's health issues, gut issues, reproductive issues. And this would be a great place for them to come to just get some insight that there is help. There is a way to get the right help so that we can start feeling a lot better. Okay, so here we go. Let's see. Hold on, just kind of playing around here. There we go. That's where I wanted. Okay. Sorry, I always forget which buttons are which when I do a presentation on StreamYard. Okay, so this is the and I don't know if you can see my mouse. I feel like when I've done presentations here before that you can't see the mouse. So I'm going to try not to have to point with the mouse too much, because then I think I'm pointing and then you're not seeing it. But so this is the topic. So this is really a functional medicine approach to optimal health and vitality at any age. And truly, while this is focused on women, there is some things in here that are going to apply to men as well. And again, for you men, if you have a female partner, you need to pay attention. So I'm starting with this picture. Obviously the person on the left is me. The person in the middle is my daughter, Hannah. She'll be 20. She was, I think, about 14 or 15 in this picture. So this was taken about 5 years ago. And that's my mom. And my mom died in 2019. So this was, not too long after she passed away. She died in late 2019, which I can't believe is already 5 years. Like, that's kind of crazy. But that was my mom. And my mom, when she died, she was 86. So she just turned 86, right? And so she was about 80 in that picture. I mean, look at her, you guys. Look at her. Look at her skin, the glow in her skin, her vitality. Like, she still had so much energy. And I am so grateful to have her genetic makeup, because, she looks amazing at 80 years old. And I'm pulling in at 58, and I feel pretty darn amazing too. So I'm super grateful that she raised me to, we grew up doing Jack LaLanne, and she gardened, and we were always moving, and she taught me how to cook. And she just, there was always, it was just always about health and wellness in our house. And if you ever watched my TED Talk, you'll see that I talked about how she cleared out our cabinets when we were little, because my brother suffered from hyperactivity, and she didn't know how to help him, and she did not want to put him on medication. And so she figured out how to just nourish us better, how to get rid of all the crap in our lives so that we would live a life as healthy adults. So depriving your kids of Captain Crunch and Cocoa Puffs and Fruit Loops is not depriving them of being children. It's actually, you're benefiting them. You are giving them the gift of good health. And so I'm always grateful to my mom, how she raised me, and she does look amazing. So yes, thank you, Stephanie. I know she looked amazing till the day she died, literally. So, So where I want to start is there's really four, actually three, but well, for our purposes here, there's four phases of women's health. We'll just go there since I have it on the screen like that. So there's four phases to women's health, and I'm going to go through the definitions, what every woman might be going through, what might be causing it, and then again, what is the common denominator and how can we help it in the end. So preconception, and I don't know why the letters, these letters are actually black. They're all black in the presentation. I don't know why they flipped white here. So I had to go back. I was like, oh, I should change those to black. And I realized they already are. And there is an N there, and somehow StreamYard turned it white. So we're just going to go with it. But preconception it's the period of time before a woman becomes pregnant. This is the time when her body is preparing for conception and pregnancy. And this is the most critical time in a woman's health. So we're talking young women. We're talking, women in their 20s and up. And listen, even, there are teen pregnancies, accidental pregnancies. But if we're just talking about women in their 20s and up who are intentionally getting pregnant, we're going to talk about accidental pregnancies here in a minute, because that is really actually, it's something to pay attention to, because it happens to a lot of people. That happened to me. But this is where we have to ensure the best possible outcomes for the mother and the baby. If mom is not healthy, if there is not a healthy terrain for the mother to grow life, then that will spill over to the baby. And the baby can then be more exposed to birth defects. It can expose the mother to difficult labors or difficult pregnancies. And we really need to make sure that for mom and baby's sake, that mom's house is as healthy as possible. So I want to go through some fertility stats, because fertility, this is absolutely shocking when you start to look at where we are worldwide in our fertility rates. So this is why I say men and young boys are not off the hook. So our worldwide fertility has dropped more than 50% in the past 50 years. That is huge. I mean, think about that. And a man today has only half the number of sperm that his grandfather had. Now, in some parts of the world, a 20-something woman is less fertile than her grandmother was at 35. And this is one of the common denominators for boys and girls, that the main thing for both of them, boys and girls, is our exposure to all of these toxic chemicals. You guys have heard me talk about this multiple times. I've done numerous videos on this channel with regards to forever chemicals, chemicals in our food, in our body care products, and in our air, in our environment, things we put on our body, and things that we don't even realize that we're exposing ourselves to on a daily basis. So these forever chemicals are actually damaging our DNA for our current generation as well as future generations. And I thought this was interesting as well. Homo sapiens already fit the U.S. Fish and Wildlife Service standard to be considered an endangered species. Isn't that crazy? I mean, we are making ourselves go extinct. So it's not acceptable. That is not acceptable for the human race. So one of the things that we see very often is this PCOS. Now, it stands for polycystic ovarian syndrome. And so many young girls start having these symptoms, and then they get put in this category of PCOS. And so this is actually, we're going to go through these stats here. Sorry, guys, I had a tickle in my throat. So this is really important to pay attention to, because so many women don't even know that they have PCOS, and the impact that it has can be devastating and catastrophic. So 1 in 10 women have some form of polycystic ovarian syndrome. Now, before we go into these stats, let me just define this. What actually is it? It's actually a hormonal condition, and it affects women of reproductive age. And it's usually there's usually several different things that can occur along with it. So women will have irregular periods. They can have ovarian cysts. They can have excess androgens, which are the male hormones, which can throw off all of their other hormones. And then they can have other symptoms, like they can be pre-diabetic, they can be insulin resistant, they can be obese. There's a multitude of symptoms that go along with PCOS, but that's the general picture. Acne is also a real common one as well. So paying attention to that. So it is the most common hormonal disorder among women of reproductive age, but many women don't know they have it. And 70 to 80% of these women are not fertile. So our fertility clinics are flooded, and there is big money to be made in the fertility world and fertility treatments. So these women who have PCOS, they tend to have higher rates of miscarriage, gestational diabetes. So that is diabetes while you're pregnant. Now, women who have gestational diabetes, there's studies that have been done that shows that if they have gestational diabetes, they actually have higher rates of cancer later on in life. So we got to, pull the reins in on this and make sure that we get these women healthy. They can also have pregnancy-induced high blood pressure, which is preeclampsia. So if you have if you know somebody who's pregnant, who has gestational diabetes, or they have preeclampsia, you want to get them to a functional medicine doctor. Now, there's not a ton we can do during pregnancy, but we will absolutely work and lean into the lifestyle issues as well as nutrition. Women are completely misguided when they get into pregnancy. They're not taught about how to actually eat for childbirth or for growing a child. It can result in preterm birth, so preemies, which can be dangerous to the baby, can also be dangerous to mom, endometrial cancer, and then there's a higher rate of C-sections because there's more complications during the pregnancy. Hey, P Squared, welcome in. Now, some challenges that these women have, and again, I apologize for some of the, it doesn't look like this on the actual slides, so I don't know why it's kind of moving along the lines there, but we're going to go with it. So they'll have irregular menstrual cycles. Now I'm going to stop there because here's what happens. You have a teenage girl who gets her period. Her periods are irregular. Now, a young girl who has irregular periods, that's actually normal. They can have irregular periods for up to 2 years while their hormones are trying to figure out what the heck they're doing. But what do we do? So young girl goes in, she's having irregular periods, and the first thing that the doctors do is they put her on birth control to control her periods. And so that is synthetic estrogen. Now that begins this cycle of reproductive issues because we're putting these synthetic hormones into the system, which causes a whole cascade of health events downstream. They can have acne or other issues. I have seen so many young girls come into my office and they have acne, and then they'll say, and even young women in their 20s, and they'll say, "Oh, I've done everything. I've done all the things. And so I'm going to go on Accutane." Accutane is an incredibly strong, is it an antibiotic? Let me get the class of Accutane. Yeah, so it's a medication. It treats severe acne. I don't actually know what its classification is for, but it's specific for treating acne, and they will give it to these women who have PCOS. So, okay, we're going to put you on the pill, and we're going to give you Accutane, and Accutane destroys the gut microbiome, destroys it. Now, being on the pill, depletes you of your B vitamins. And so now you can see, okay, we're going to damage the gut and we're going to destroy your B vitamins and we're going to cause anemia. It's not a great place for women to start, because as we get older and then we want to have babies, then we need those B vitamins. The baby's brain and nervous system requires solid B vitamins in the mother. It requires the mother's gut to be healthy so that the mom can absorb the nutrients that she needs to absorb to give it to the baby. So then we get into our digestive disturbances. So, what came first, the chicken or the egg? A lot of women already have gut issues when they had PCOS, or they get PCOS because they have gut issues. We don't know. It's circular, but we have to fix the gut. They're tired. Their adrenals are burnt out. Adrenals are what gives you your energy. And then they have fluctuations in weight, but oftentimes they gain weight and they can't lose weight. These women have a very difficult time losing weight. And of course, there we see infertility or difficulty conceiving, which from the previous slide, we saw that 80% of women who have PCOS will have difficulty, will be infertile. So hirsutism is hair growth, like on the face, in places that we don't want to grow it. And that's from the excess androgens. And then insulin resistance. So that leads to obesity. They have pain, inflammation. It leads to birth control. Symptoms following the HPV vaccine. They will give these young girls this particular vaccine for what's the oh my goodness, I'm losing track of the, sorry, my mind just went blank on why they give the HPV vaccine for HPV infection. So I'm losing, it's a herpes infection. Anyway, so they give this vaccination, they give this injection. And that particular injection has a high amount of formaldehyde. And formaldehyde is a known sterilizing agent. Now, here's what's interesting, because there were several studies that showed that there was a correlation between this particular injection and infertility in young girls, or they call it ovarian failure. What you'll find is a lot of personal stories of young girls that had that and then completely lost their periods and now are completely infertile. What happened in some of these journals is you'll go and you'll see the you'll get the title from when it was published, and then it'll say retracted. Yeah, it's retracted because these companies don't want bad press. They want to keep pushing this. They don't have an incentive to, they're not getting sued enough to take these things off the market. I guarantee you that particular shot will be taken off the market at some point. But in the meantime, it is damaging our young girls. So also gallbladder issues are another very common. So it goes along with digestion, the obesity, the prediabetes, the acne. And then of course, if you have history of fertility treatments, that's more synthetic hormones. So we're just kind of like in this crazy circular phase in that young time of our lives. And so instead of actually treating the body with lifestyle and nutrition, then we just keep throwing, we give it birth control, we give it fertility treatments, or we give it Accutane. We put young girls on if they have acid reflux, we put them on acid blockers, fiber supplements. So there's not enough information for these young girls to know, how do I even be healthy? What does that even mean? So then we move from our preconception phase into perimenopause. Now, this is the phase that leads up to menopause. So usually women now start to have irregular menstrual cycles. Their hormones start to change dramatically. It's this like crazy. It's like, I always think of that pirate ship ride at the carnival, swings way up in one direction and then comes down and swings in the other direction. It keeps doing that. I feel like that's a lot how my female patients, how they feel. They're just going from one extreme to the next and they can't get a handle on it. Now, this will typically start in around 40 on the young side and then all the way through 40s. I mean, perimenopause can last years, this ebb and flow, surges of hormones. And oftentimes women just they feel frustrated. They feel like they're going crazy. Oh my God. Like I've had more of my patients say to me, I think I'm going crazy, which would also explain why many of these women, when they go to get help, the only option they're given is an SSRI or antidepressant or anti-anxiety. There's nothing that is addressing their needs from a holistic and lifestyle perspective. Well, there is, but it's not common. And I have the answers. So I'll give you that in a minute. So women get frustrated. They don't know what else to do. And yeah, P squared, unless you have a hysterectomy, then it's instant menopause. I mean, that's crazy. And then it's like, it is instant menopause. That is a shock to the system. And so oftentimes too, so women are just managed through their reproductive health issues for years, again, without even being offered any options for anything other than you're going to need a hysterectomy. We'll just wait till it gets bad enough. There are ways to manage your reproductive health in a healthy, holistic way. And again, you've heard me address a lot of these things before. So I'm not going to go too deep into the treatments because again, there's a lot of other videos on this channel that talk about that. But let's just talk about what women experience in perimenopause. So here we go. Here's our regular periods, much like when you're in preconception. This is when the hot flashes and the night sweats start. So we're not sleeping. Like we're like, oh my God, I'm not sleeping. I just want to sleep. The mood swings, the irritability, the increased anxiety. This is why many women are given SSRIs because doctors are like, yeah, you're just depressed. You just need a pill. So brain fog, difficulty concentrating. That's a really common one women come to me with. Our sleep disturbances, decreased libido. That's huge because estrogen starts to go down, testosterone starts to go down. And there are ways to make sure that you are continuing to tap into your natural sources. There's weight gain, particularly around the midsection, frustrating. Again, these are the women that are saying, I'm doing all the things, I'm doing everything right, and I'm still gaining weight. You guys, I struggle with that. Okay. I'm of normal weight, but I can tell, like I get a little muffin toppy and I'm like, oh my God, where's this thing coming from? And you want to live a healthy life, come and eat out of my kitchen for a week, and the exercise, and it's super, super frustrating. Increased frequency of urinary tract infections is because the biome changes in the urogenital tract. Urine frequency or urgency, pelvic floor dysfunction or issues. Many of these women struggle with pelvic floor weakness. And what's interesting is there are things within your diet that can be weakening the muscles of the pelvic floor. Pelvic floor is just a muscle. So what do we need to do to make sure we're not weakening it? Vaginal dryness or painful intercourse. I mean, like brutal. Like, why do we have to go through that? Muscle and joint pain. If you were on, was it last week or a couple weeks ago? And I hurt my wrist. Maybe it was on a Reset Monday. I can't remember. And everybody was like, how'd you hurt your wrist? I'm like, I woke up. I'm, menopausal women. And I woke up. I woke up with wrist pain. So that's what happens. We wake up with these random pains. We're like, where the heck did that come from? Loss of bone density, very common. So we have to make sure that we're tapping into making sure we have healthy bone density, because as we get older, the risk of falling, the risk of breaking a bone, we do not want to end up in the hospital. And then changes in skin elasticity. Our skin starts to get saggy and crepey because we lose that beautiful estrogen that keeps our skin supple and springy. So also, if women have had a history of fertility treatments, they can experience these in even worse, at worse levels. So Idaho Garden Girl says, I had a few hot flashes, but losing my ability to think was the worst symptom. because you're literally like that one picture, you're like, oh my God, am I going crazy? So, so as we go through menopause, we have, now this is just an overall definition, 12 consecutive months without a period, marking the end of a woman's reproductive years, and cessation of ovarian function, and a significant decline in estrogen and progesterone levels. But to P squared's point, if you have a hysterectomy, yeah, it's instant menopause. Do you have to wait 12 months after a hysterectomy to be told you're in menopause? You know, the hormones are still going to respond to that. So, so it's just interesting. And these are just textbook definitions. They are very fluid because, you know, the female body, the female body is very fluid. So this is what so many women feel like over the course of their lives as they go through this. I mean, do you guys see any pictures in here that resonate with you? I like the one with the woman with the squiggly lines over her head up here in the upper left corner. Again, I don't think you can see my mouse, but you got this woman on the far left, difficulty sleeping, the stress, the job stress just below that. The onset of autoimmune diseases, that is also a real thing. Hair falling out, more acne, aches and pains. You feel like you want to scream. And of course, excess bloating and abdominal issues or digestive and gut issues. So it's a real thing. So some of our stats is 2 million women enter menopause yearly. 75 million women are in perimenopause, menopause, or postmenopause in the United States, with more than 6,000 reaching menopause each day. Now, I'm going to tell you why these stats are so important, you guys. 75% of women who seek medical care are left untreated. So here we have all these women struggling, and yet 75% of them, they go completely untreated because they don't know where to go, they don't know who to go to, or what information to even believe. 38% who are in perimenopause, that phase leading up to menopause, experience some level of depression. Estrogen is incredibly neuroprotective. That means it protects your brain. And so when we lose estrogen, we lose that protection in our brain. It is anti-inflammatory. So our brains then, you know, it's protective of the inflammation going into the brain. And when we lose that, that's when we get that brain fog, and we can experience depression, anxiety, things like that. 80% of gynecologists residents admit to being ill prepared to discuss menopause. And 1/3 or more of women reported that it took them over 2 years and they had to see more than 3 health professionals before a diagnosis was established. And then one of women's their most common concerns were difficulty losing weight. So again, this is where I say this is our epidemic. We have all these women in the world. And here's what's interesting is, you know, back like in the 1800s, when, you know, women, the life expectancy of a woman was in her 50s. Well, so if you think about it, that's typically when women go through menopause and then they just died. Well, you know, now we're not doing that anymore. You know, we're living a lot longer. So we have to be able to exercise our right to live with full vitality beyond our 40s and 50s. So so here's how women felt. This was a study. I've got to make sure I put the link for the study in here. But 18% of women, only 18% were accepting of it. 15.8% were dreading it. 5% were looking forward to it. 38.1% of women felt that menopause was difficult. And 24.6% felt it was very difficult. 20.7% felt it was fine. 94.1% of women had never been taught about menopause in school. And 49% did not feel informed at all about menopause. This is kind of like not discussing sex with your child. I mean, this is a part of life, and we're not taught anything about it. And more than 60% started looking for information regarding menopause as their symptoms started. So this is also why it can take so long for a woman to find help with this. Idaho Garden Girl says, thanks to HRT, we live longer. Yeah, and we don't necessarily need HRT to live longer. I'm going to address that in a minute, because I do have some thoughts on HRT. I'm not saying it's bad at all by any means, but you'll see. Stay tuned, and you'll see. So here's what we get challenged. So we stop having our periods. We get hot flashes and night sweats, vaginal dryness and thinning, which is what creates that painful sex, a decreased libido, mood changes such as depression, anxiety, memory issues, that cognitive decline, sleep disturbance, insomnia, muscle, joint pain, weight gain around the abdomen, loss of bone density, loss of muscle, increased risk of cardiovascular disease, urinary incontinence, or frequency hair thinning or loss. Did I get everything? It's not fair. It's not fair. I don't think it's fair. So here's the problem. This is so funny. Okay, these little white boxes here along the side, it says lack. Okay, yeah, there's words in there, but I don't know why StreamYard has changed it. Okay, so we have a problem. The common problem with all three of those phases is there's a lack of knowledge and there's a lack of education. And then the lack of available information for any of these women, from young women to women in their menopausal years. I'm not going to say old women. There's a lack of proper information. And it becomes very taboo to speak about. So this is why I really wanted to develop this program. And I want to bring it here on this channel, because I don't want women to be afraid to have these conversations. We should be able to have open conversations about what's happening with our health, our bodies, and we need men to have a greater understanding of what it is that we go through, because as crazy as we feel, then men might not feel like, they can't figure us out, they might be a little more understanding of what we go through. So Stephanie says, I got no education about menopause. My mother gave me a pamphlet about menopause. That's the most information I got. And the message in the pamphlet was, if you have questions, ask your healthcare provider. Oh, that's great, isn't it? Mm-hmm. Who didn't know anything, right? I wonder where she got the pamphlet from. I'd be super curious to know about that. So this is what we do. So I'll address HRT right now, Stephanie, since you brought that up. So HRT is, there were these studies done many years ago. So a lot of women were on hormone replacement therapy. And then there was some studies that showed that HRT caused cancer, breast cancer, ovarian cancer, the reproductive cancers. These women years ago were being put on synthetic estrogens, synthetic hormones, which can have a detrimental effect. But hormone therapy has come so far in so many years that we can now get bioidentical, meaning it matches our body's natural hormones. It's not synthetic. So this is really important to understand that women may need hormone replacement therapy, but I want to always put the microscope on, what does your lifestyle look like? What are you doing each and every day that could be feeding this crazy hormone swings that move up and down like the pirate ship? What can you be doing in your daily life that promotes better hormonal health? So if you're new to this channel, I've done multiple videos with regards to hormone disruptors like forever chemicals and body care products. If you've been here with me since I started the channel, or just if you're a longtime viewer, thank you, by the way. But you've heard me talk about this multiple times, is that these chemicals in our that we're eating, we're drinking, we're putting it on our bodies, it's in our air, it's perfumes, it's dyes, it's laundry detergent, it's things that go in the air, it's all around us. And these are called hormone disruptors for a reason, because they disrupt your hormones. They prevent your body from functioning the way it's supposed to function. So what happens is that if you go and you get hormone replacement therapy, so you get like an estrogen patch or progesterone, or you get testosterone pellets with the estrogen pellets, whatever it looks like, it's going to look very different for each and every person. But if you go do something like that and you haven't taken care of the things in your environment that are still messing up your hormones, it may help, but you're really just putting a Band-Aid on it, because you may need more estrogen or progesterone or testosterone than you might actually really need, because you're jazzing up your hormones with all this other stuff in your environment. I hope that makes sense. So here's what I encourage. I really encourage that you look at lifestyle. How can you support and manage your lifestyle habits, eliminate the things that are disrupting your hormones? And there's things we're not going to be able to help. There's going to be things in the air. Our neighbors are still going to spray chemicals on their lawn. Can't do anything about that. But we can manage our own homes. We can manage our own bodies, our kids, making sure that we're raising our kids to have healthy bodily houses, if you will. And the more we can do that, then the easier it becomes as we start to move through all these different phases in life. So hormone replacement therapy, and I'll give you another example here, Stephanie and P Squared and whoever else is listening, is that I have a patient that I'm working with now. And I mean, this is classic. She's 50, she's about my age, 56, 7, something like that. And she's on hormone replacement. She's doing testosterone pellets along with the estrogen pellets. She could not lose weight, was having a very, very difficult time losing weight. Claimed she had done everything and went on the Ozempic shot. Lost a ton of weight, lost a lot of muscle. I could absolutely tell she lost a ton of muscle. But then, she started working with me just a few months ago. And as I started to question her about, what she'd been through, what was her history, I was able to now start to piece together her life from 30 years ago. And she was not making any connection with what was going on 30 years ago in her health and her life and her gut and her reproductive, things that were happening reproductively to now. So it's really interesting that we have to pay attention, is that just this snapshot in time, this is where you are because of all of the things that happened in the past, good or bad. So if we can have more awareness of our health and well-being while we're younger, and what we put in our bodies and what we put on our bodies and everything in our environment and how we raise our kids, if we can have more awareness of what we've done then, and really building that foundation of cleanliness, if you will. So, living with as few chemicals as possible. If we can do that way back then when we get to our 30s, 40s, and 50s, it's not going to be as big of an issue. You're still going to go through menopause. You're still going to have fluctuations. It just is hedging your bets that the process should be a lot easier. So I checked her. I was checking her blood. She went and had some labs and sent me her lab work. And she's now, for a woman, if you're taking testosterone, your testosterone should be somewhere between like 50 and 100 max. 100 is it's nanograms per milliliter, something like that. Anyway, so it should be between 50 and 100. Her testosterone was 350, and she's having some major issues. But she was thinking that, she has that on lock because she's seeing a hormone doctor for that. And I said, you need to go back right now or on the next visit. Here's the problem with the hormone pellets, is that her blood work is far too high. Her testosterone should not be that high. You can't take the pellets out, and you can't counteract the testosterone. She has to now just wait for her levels to come back down before she goes back in to have more pellets. And the problem with that is, with that level of testosterone in a woman, it can create anger. It can disrupt sleep. It can disrupt your brain. Or you could feel like Superman, Superwoman. And then when your testosterone levels get back down to where they should be, between 50 and 100, you might be like, oh my God, I feel terrible. Well, you've had this artificial boost of hormones. So hormone replacement it can be a good thing, but it is also critical, again, to make sure it is managed properly by the right people. So this is a conversation that I have to have with her with regards to her current hormones, and how where she's at is not managing her hormones properly at all. So no woman should be at a 350 nano whatever. We'll just say 350. I always forget which one it is. Yeah. So let's see what Stephanie says. I have bioidentical HRT. It's a topical cream. If I don't apply it a couple of days, about all I can do is sit in a chair. No energy and zero brain. I can't even remember what I remember. Oh, that's, yeah. Is it estrogen? Is it progesterone? Or is it a combo? Is it testosterone? And this also is there's a lot of different forms out there. And what's interesting about HRT for women is that if a man goes in, and let's say let's go here. Let's go in the menopause challenge. Or if we went here. Okay. So if a man goes in and says, I'm having mood swings, brain fog, sleep disturbances, decreased libido, weight gain, urinary frequency, muscle and joint pain, you know what the doctors are going to say? You have low T. We need to put you on testosterone. And guess what? Testosterone is covered under insurance for men, but it's not a covered benefit for women, because women, we just get completely forgotten about. So you can get testosterone therapy, but you have to find the right people. There aren't very many practitioners that can do testosterone. And again, it's commonly in the form of pellets. You might be able to get a cream for it. I don't know much about injections, but either way, you've got to be able, I like the idea of the cream because you can manage the dosing a little bit better. But you have to find what's right for you, just finding somebody you can trust. So my level of expertise stops at do you need hormone treatment? Meaning, if we do all of these things, this is everything that I've presented to you so far, up to the lifestyle interventions, this is my level of expertise. So there are supplements that I can give you that help support your testosterone, your estrogen, your progesterone levels, and help with sleep. So I do manage hormones with supplementation very successfully. Now, if we do the lifestyle interventions and you're good about taking your hormones and your diet is good and you're getting good sleep and you're still having issues, that's when, okay, let's now maybe we need to start looking at hormone replacement. But you've got to have all of this in check. It doesn't work without it. So some of the common things that women will say to me is, they'll say, when we talk about, we've got to do the intervention, lifestyle intervention, they'll say, I think it's my hormones, without regard for the fact that they don't exercise, they don't eat well. And they'll say, I did the gluten-free, dairy-free thing, because a lot of times it's a food allergy or food sensitivity. I had allergy testing done already. I don't need more. I wasn't allergic to anything, is what they might say. Because mostly what will happen is they'll have a gut issue. There'll be some food sensitivities, some other health issues that we need to address dietarily. We got to get them exercising. You have to get them sleeping. So, and a lot of times if you work with me, I'll say, I need you to keep a food journal. Well, before I say that, then people will say, oh, I eat really well. And then I'll say, okay, I'm going to have you keep a food journal. And then they'll say, oh, no, you don't even want to know what I eat. So, well, which one is it? Do you eat well, or I don't want to know what you eat? Or they'll say it's normal for me. You know, they don't have a daily bowel movement. They'll say, well, that's normal for me. It's not normal for anybody. But this is the most common. I'm doing all the right things and I'm still gaining weight. So, and so Stephanie does, okay, a estrogen, testosterone cream, progesterone capsule at night. Yeah. So, and that's a really great way to manage your hormones. And then also just making sure you're getting tested every 6 months or so. So what do we do for treatment? Everything is a gut problem until proven otherwise. I don't care what it is. If it's autoimmune, if you're having chronic migraines, if you have chronic pain, if you're having irregular periods, if you have any symptoms of PCOS, it's a gut problem until proven otherwise. So we have to fix the gut. We work on fixing sleep. We do an elimination diet, which tends to be gluten-free and dairy-free, depending on your food sensitivities, food allergies. We basically want to take out of the diet the most allergenic things that you could be having. And so we do that through a healthy detox that involves food and involves specific medical foods that will actually help to clean out the excess estrogens and toxic chemicals from your tissues and safely get them through the liver and through the kidneys and out of the body. The bowels must be moving. So if you're somebody who you don't have a bowel movement every day, that's an issue. We've got to make sure we clean that up. Clean up environment, reducing stress, get you moving and breathing, and address other lifestyle habits. And I know that seems like a lot. It's a process. It doesn't happen overnight. But, this is probably 6 months of when we start working together. This is probably 6 months. It's layering it out. I may start with an elimination diet. I may start with a healthy detox. I might start with, I got to get your bowels moving first. We might start with environmental things. It really just depends. Everyone is so very different. And this is why these are customized programs that we do in my office. Is they're customized to you, to your needs, and to, it's strategizing what is going to get us to the best you most efficiently and with the best success. So that's pretty much it. Let me bring myself back there. Okay. A good BM makes my day every day. Yes, I know. Yes. It's like happy dancing. And Stephanie says, I see my naturopath every 6 months, if not sooner. Good girl. Good job. I do my own blood work, so I'm about due, definitely due for some labs. So I will be getting some labs done here shortly. Thank you for that reminder. And I know it's like, can you imagine? Like, I couldn't even imagine what it would feel like to not have a daily bowel movement. I know, kind of crazy, huh? So, do you guys have any questions about that? What do you think? Do you have women that you know that are struggling? Are you struggling? Hydration. I am so thirsty. I did a yoga class this morning. Hot yoga, cleansing, that's detoxifying, that's movement. So good. But it was hot today. I got a little dizzy in class today. So, so that's it. So I'm presenting this weekend to women chiropractors. I'm really excited. And I think it's just really critical that more women know that there's a sound resource for them to be able to get their needs met. These are very unique needs. And part of the reason that women don't have resources is because most of the studies have been done on men. We just kind of get left out in the cold, P Squared says, I might have liked to go through menopause naturally. Yeah, it was interesting. My my sister asked me years ago, she was like, when are you going to go through menopause? And my mom had a hysterectomy when she was, I think, in her 40s. My sister had a hysterectomy, I think, when she was in her 30s. I think she had endometriosis, maybe. And my sister says, she would always say, when are you going to go through menopause? And I'd say, well, if the women in this family would quit having their shit ripped out of their bodies, maybe I would know. So I think I was probably 54, maybe, when I stopped. 55, maybe 55 even. I don't know. Yeah, it's really only been about 3 years. So yeah. Yeah, if I have a headache, first thing I think of is I need to poop. If that's not it, then I'm probably ill. For real. Yeah. I know. I go through those like for me, I think hydration and adjustments, for sure. I can get a headache too. Like I started getting migraines when I turned 40, literally, like when I turned 40. And I remember I didn't know it was a migraine. It felt like somebody was stabbing me in the back of the head. It was just like this. It was constant. It would literally like cause me to like throw my head forward. Ended up in the hospital just for a day because of it. Didn't know what it was. They're like, oh, you're having a migraine. But also, I was getting chiropractic adjustments. I think that's when I started getting more acupuncture. I don't think I'd been doing yoga yet. I can't remember. But yeah. And then, over the course of the last almost 20, 40, 50, 20 years, I've made a lot of changes to my diet too. I always had a healthy diet, but just kind of really leaned in more on making sure that, fewer and fewer chemicals, started canning my own food, really, just keeping, I can't even say that I didn't always have fresh food on hand. So I don't really know what it was, but it's definitely better. But every now and then I'll get this sort of like, get the eyeball headache thing. Probably once a year I get the eyeball thing. And I do end up having to take like a Motrin. It's the only thing that gets rid of it. So, how annoying is that? That I'm the holistic gal, and sometimes I have to succumb to medication, but that's why it's there, right? I guess one time a year versus, a lot of people are taking that stuff on a weekly basis. So, yeah. So water for sure, hydration, absolutely. So yeah, so you guys are going to see more on women's health rolling out. If there's anything specific that you want to see or any questions that you would like answered, always reach out to me. Let me throw my email address in here. Stephanie, I know you have it. Actually, P Squared, you have my cell phone number. So, but anybody else who's on here, there is my email address. So feel free to drop me a question, a comment. Drop a question or comment in the comments here, and let me know what your thoughts are, because I'll be bringing more of this to you guys as we roll out this program. So my doctor gave me samples of Curafin. It's natural painkiller pills. Let me look that up. I have not heard of that. Curafin, extra strength. I don't know what it is. Let's look it up. Let's see what it is. P Squared. There it is. Okay, this is not P Squared. That was, I think, Stephanie. Boswellia, phenylalanine, Boswellia, curcumin. Okay, so it's anti-inflammatory. So that makes sense. Yeah. Oh, nattokinase. Okay. Yeah, that yeah, so that's great. And yeah, it works on pains. And Metagenics just came out with let me see if it pops up on the front page. This rapid relief. This is really cool. So this is like natural. This also has turmeric, boswellia, black sesame seed oil. I have to place an order this week. I cannot wait to get this on track. So this is a similar, I'd be curious to compare those two products, P squared, to see dosages on either one, but I'm going to drop this one. This is in my online store. So I'm super excited to get that one on deck there. So yeah. So, all right, you guys, thank you so much for being here. I like to say, let me know your comments, questions. If you like this, please share it. Please subscribe. Share this episode out for anybody who we need to get on deck, and just get the message out to women that there are answers, and we have some answers right here on this channel. And hey, if I don't have the answers, I know a lot of people that I can get you in the right direction. So keep that in mind. All right, you guys, thanks again. We'll see you tomorrow for Reset Monday, and see you Thursday for Chiropractic is Sexy. Have an amazing week. Talk to you soon. See ya. Thanks for being here.